Rashes are a common skin concern that can appear suddenly or develop over time. They often cause discomfort, itching, or redness, and may be a sign of an underlying issue. In this video, we'll explore what causes rashes, how to recognize when a rash is serious, and what steps you should take if you notice changes in your skin. Understanding the basics of rashes is essential for everyone, as they can affect people of all ages and backgrounds. Let's begin by looking at the different types of rashes and their typical symptoms, setting the stage for a deeper dive into their causes and potential risks. Rashes can present in a variety of ways, including redness, swelling, bumps, blisters, or peeling skin. Some rashes are itchy, while others may cause pain or a burning sensation. The appearance and sensation of a rash can help determine its cause and severity. For example, a mild rash might only be slightly red and itchy, whereas a more severe rash could involve blisters or open sores. Recognizing these symptoms early is important for proper care and treatment. Next, we'll discuss the most frequent causes of rashes, helping you understand why they occur. One of the most common causes of rashes is an allergic reaction. Allergies can be triggered by foods, medications, plants, or even certain fabrics. When your body reacts to an allergen, it releases chemicals that cause inflammation and skin changes. Allergic rashes often appear suddenly and may be accompanied by itching, swelling, or hives. If you suspect an allergy is causing your rash, it's important to identify and avoid the trigger. We'll now move on to discuss other causes, such as infections and environmental factors. Rashes can also be caused by infections, including bacterial, viral, or fungal sources. For example, chickenpox, measles, and ringworm are all conditions that produce distinctive rashes. Infectious rashes may be accompanied by fever, fatigue, or other symptoms. It's important to recognize when a rash might be linked to an infection, as some require medical treatment to prevent complications. Next, we'll look at how environmental factors can contribute to rash development. Environmental factors such as heat, humidity, or exposure to chemicals can lead to rashes. Heat rash, for instance, occurs when sweat gets trapped in the skin, causing red bumps and discomfort. Contact with harsh soaps, detergents, or cleaning products may also irritate the skin. Understanding your environment and minimizing exposure to irritants can help prevent these types of rashes. Next, we'll discuss how chronic skin conditions play a role in rash development. Some people experience rashes due to chronic skin conditions like eczema, psoriasis, or rosacea. These conditions often cause recurring rashes that may flare up in response to stress, weather changes, or other triggers. Managing chronic skin conditions typically involves ongoing care, including moisturizing, avoiding known triggers, and sometimes using prescription medications. Understanding the nature of these conditions can help you better manage symptoms and prevent flare-ups. Next, we'll explore how physical factors like friction and pressure can cause rashes. Physical factors such as friction, pressure, or tight clothing can lead to rashes. For example, chafing occurs when skin rubs against itself or clothing, resulting in redness and irritation. Pressure sores can develop in people who are immobile for long periods. These rashes are often preventable by wearing comfortable clothing, staying dry, and moving regularly. Next, we'll discuss how stress and emotional factors can influence skin health and rash development. Emotional stress can impact your skin, sometimes leading to rashes or worsening existing conditions. Stress may trigger flare-ups in chronic skin disorders or cause hives. Managing stress through relaxation techniques, exercise, and healthy habits can help reduce the risk of stress-related rashes. Next, we'll look at how age and genetics influence rash susceptibility. Age and genetics play a role in how susceptible you are to rashes. Babies and older adults often have more sensitive skin, making them prone to irritation and rashes. Genetic factors can also influence the likelihood of developing certain skin conditions. Knowing your risk can help you take preventive measures and seek appropriate care when needed. Next, we'll discuss how to recognize when a rash is serious and requires medical attention. Not all rashes are harmless. Some may signal a serious underlying condition, especially if they are accompanied by other symptoms like fever, difficulty breathing, or rapid spreading. It's important to know the warning signs that indicate a rash is more than just a minor irritation. In the next scenes, we'll outline specific symptoms and situations that require urgent medical attention. A rash accompanied by fever can be a sign of infection or a systemic illness. This combination should never be ignored, as it may indicate conditions like meningitis or measles. If you or someone you know develops a rash and fever, seek medical evaluation promptly. Next, we'll discuss rashes that cause pain or discomfort beyond itching. Rashes that are painful, blistering, or involve open sores may indicate a more severe condition, such as shingles or a bacterial infection. These types of rashes often require medical treatment to prevent complications. If you notice blisters or sores, especially if they spread quickly, consult a healthcare provider. Next, we'll look at rashes that affect the eyes, mouth, or genitals. Rashes that appear in sensitive areas like the eyes, mouth, or genitals can be particularly concerning. These rashes may interfere with daily activities and could signal a more serious health issue. It's important to seek medical advice if you notice a rash in these regions, especially if accompanied by pain or swelling. Next, we'll discuss rashes that spread rapidly or cover large areas. A rash that spreads quickly or covers a large portion of the body may be a sign of a severe allergic reaction or infection. This situation can become life-threatening, especially if accompanied by difficulty breathing or swelling. Immediate medical attention is necessary in these cases. Next, we'll look at rashes associated with other systemic symptoms. If a rash is accompanied by systemic symptoms, such as joint pain, swelling, or difficulty breathing, it may indicate a more serious underlying condition. These symptoms can be associated with autoimmune diseases or severe allergic reactions. Recognizing these signs early can help prevent complications. Next, we'll discuss the importance of medical evaluation for unexplained rashes. Sometimes, rashes appear without an obvious cause. These unexplained rashes can be frustrating and may require medical evaluation to rule out serious conditions. If a rash persists, worsens, or is accompanied by other symptoms, don't hesitate to seek professional advice. Next, we'll explore how doctors diagnose rashes and what tests may be involved. Doctors diagnose rashes by examining the skin, asking about symptoms, and sometimes ordering tests. Skin biopsies, blood tests, or allergy testing may be used to identify the cause. Accurate diagnosis is essential for effective treatment and preventing complications. Next, we'll discuss the common treatments for rashes and how to manage symptoms at home. Many mild rashes can be managed at home with simple remedies. Keeping the skin clean, avoiding irritants, and using over-the-counter creams can help relieve symptoms. It's important to avoid scratching, as this can worsen the rash or lead to infection. Next, we'll discuss when to seek medical help for a rash. You should seek medical help if a rash is severe, spreading, or accompanied by other symptoms like fever, pain, or difficulty breathing. Early intervention can prevent complications and ensure proper treatment. Next, we'll look at preventive strategies to reduce the risk of developing rashes. Prevention is key to avoiding rashes. Simple steps like wearing comfortable clothing, using gentle skin products, and avoiding known allergens can make a big difference. Staying hydrated and maintaining good hygiene are also important. Next, we'll discuss the role of nutrition and hydration in skin health. A balanced diet supports healthy skin and can reduce the risk of rashes. Foods rich in vitamins A, C, and E, as well as omega-3 fatty acids, help maintain skin integrity. Drinking plenty of water keeps the skin hydrated and resilient. Next, we'll look at the importance of regular skin checks and monitoring changes. Regularly checking your skin for changes can help catch rashes early and prevent complications. Look for new spots, changes in color or texture, and any unusual symptoms. Early detection allows for prompt treatment and better outcomes. Next, we'll discuss how to communicate with your healthcare provider about skin concerns. When discussing rashes with your doctor, be prepared to describe the appearance, duration, and any associated symptoms. Providing photos can help with diagnosis. Open communication ensures you receive the best care and guidance. Next, we'll look at the importance of following treatment plans and avoiding self-diagnosis. Adhering to your doctor's treatment plan is crucial for resolving rashes and preventing recurrence. Avoid self-diagnosis or using unapproved remedies, as these can worsen symptoms. Consistent care leads to better skin health and fewer complications. Next, we'll discuss the impact of weather and seasonal changes on rash development. Weather and seasonal changes can affect skin health and increase the risk of rashes. Cold, dry air may cause dryness and irritation, while hot, humid conditions can lead to heat rash. Adjusting your skincare routine according to the season helps maintain healthy skin. Next, we'll explore how exercise and sweat can influence rash development. Physical activity is great for overall health, but sweat can sometimes cause rashes, especially in areas where skin rubs together. Wearing moisture-wicking clothing and showering after exercise can help prevent sweat-related rashes. Next, we'll discuss the importance of choosing the right skincare products. Selecting gentle, fragrance-free skincare products can reduce the risk of irritation and rashes. Avoid products with harsh chemicals or allergens. Patch testing new products before use is a smart way to prevent adverse reactions. Next, we'll look at the role of allergies in rash development. Allergy testing can help identify triggers that cause rashes. Skin prick tests or blood tests are commonly used. Knowing your allergens allows you to avoid them and reduce the risk of future rashes. Next, we'll discuss how pets and animals can sometimes contribute to skin irritation. Pets can sometimes cause skin irritation or rashes, especially if you are allergic to their dander or saliva. Regular grooming and cleaning can help minimize exposure. If you notice a rash after contact with animals, consider allergy testing. Next, we'll discuss the impact of household products on skin health. Many household products, such as detergents, cleaning agents, and fragrances, can irritate the skin and cause rashes. Choosing hypoallergenic and fragrance-free options can help reduce risk. Always follow safety instructions and avoid direct skin contact when possible. Next, we'll look at the role of occupational exposure in rash development. Certain jobs expose workers to chemicals, irritants, or allergens that can cause rashes. Wearing protective clothing and following safety protocols is essential. If you develop a rash at work, report it and seek medical advice. Next, we'll discuss how travel and new environments can affect skin health. Traveling to new environments can expose your skin to unfamiliar allergens, climates, or hygiene practices. It's important to be aware of these changes and take preventive measures. Carrying your own skincare products and avoiding risky exposures can help. Next, we'll look at the impact of medications on rash development. Some medications can cause rashes as a side effect. Antibiotics, anticonvulsants, and blood pressure drugs are common culprits. If you develop a rash after starting a new medication, contact your doctor immediately. Next, we'll discuss how to differentiate between mild and severe rashes. Mild rashes are usually localized, cause minimal discomfort, and resolve with home care. Severe rashes may spread, cause pain, or be accompanied by other symptoms. Knowing the difference helps you decide when to seek medical attention. Next, we'll discuss the role of immune system disorders in rash development. Autoimmune diseases like lupus or rheumatoid arthritis can cause rashes as part of their symptoms. These rashes may be persistent and require specialized treatment. If you have an immune disorder, regular monitoring and communication with your doctor are essential. Next, we'll discuss how hormonal changes can influence skin health. Hormonal changes during puberty, pregnancy, or menopause can affect skin health and increase the risk of rashes. These changes may alter oil production, sensitivity, and immune response. Managing hormonal influences involves maintaining good skincare and consulting a doctor if needed. Next, we'll discuss how to care for sensitive skin types. Sensitive skin requires extra care to prevent rashes. Use mild, hypoallergenic products and avoid excessive washing or scrubbing. Moisturizing regularly helps maintain the skin barrier. Next, we'll discuss the importance of avoiding triggers and maintaining a healthy lifestyle. Identifying and avoiding triggers is crucial for preventing rashes. Keep a diary of skin reactions and note any patterns. Avoid known allergens, irritants, and stressful situations when possible. Next, we'll discuss how to build a personalized skincare routine. A personalized skincare routine tailored to your skin type and sensitivities can help prevent rashes. Consult a dermatologist for recommendations and adjust your routine as needed. Consistency is key to maintaining healthy skin. Next, we'll discuss the role of education and awareness in rash prevention. Educating yourself about rash causes and prevention empowers you to make informed decisions. Awareness of warning signs and risk factors helps you act quickly when needed. Sharing knowledge with family and friends can promote better skin health for everyone. Next, we'll summarize the key points covered in this video. Rashes can be caused by a variety of factors, including allergies, infections, environmental triggers, chronic conditions, and more. Recognizing the cause is the first step in effective treatment and prevention. Understanding when a rash is serious ensures timely medical attention. Next, we'll review the signs that indicate a rash requires urgent care. Urgent signs include fever, pain, rapid spreading, involvement of sensitive areas, and systemic symptoms. If you notice any of these, seek medical help immediately. Early intervention can save lives and prevent complications. Next, we'll highlight the importance of ongoing skincare and monitoring. Maintaining ongoing skincare is essential for preventing rashes and promoting overall health. Regular moisturizing, gentle cleansing, and avoiding triggers are key strategies. Monitoring your skin for changes ensures early detection and treatment. Next, we'll discuss how to support others dealing with rashes. Supporting friends or family members with rashes involves empathy, encouragement, and sharing helpful information. Remind them to seek medical advice when needed and assist with daily care if possible. Creating a supportive environment can make a big difference in recovery and well-being. Next, we'll conclude with final thoughts on rash awareness and prevention. Rashes are a common issue, but understanding their causes and knowing when to seek help is vital. By staying informed, practicing good skincare, and supporting others, you can reduce the risk and impact of rashes. Remember, your skin is a reflection of your overall health, so take care of it and pay attention to any changes. Thank you for watching, and stay healthy.